Okay. Hello, everyone. Welcome to Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. We're here today to talk about sex differences in the brain. How are women's brains different than men's brains? And where is research going and heading to determine how these differences can really lead to disease prevention? So joining me today, we're very happy to have with us Dr. Antonella Chadha. She is the CEO of the Women's Brain Project. Welcome, Antonella.
Nice to meet you, Deborah. It's a joy to be your guest today. And of course, I'm pleased to meet also your audience.
Thank you so much. So I want to start first with the simple fact that 2/3 of Alzheimer's cases are women. And we used to think that's because women lived longer, but now there seems to be a consensus that that isn't so. In fact, there are really differences in women's brains that make some more predisposed to Alzheimer's. So I want to really start with what do we know in terms of the research?
Well, what it is known is that indeed the female brain, it is more prone to develop those type of neurodegenerative diseases, above all Alzheimer. And what we know is that there are several risk factors that are specific for women. For example, one of those, it is the, let's say, menopausal phase that we all have to go across at a certain point of our life. These hormonal changes might predispose to have higher sensitivity to develop Alzheimer's disease. And it is speculated that this is due to the fact that estrogen are in fact kind of neuroprotective, and the drop in estrogens that one experiences during menopause might be one of the predisposing factors. There are also other reasons that might be due to the fact that we are women. And one of those that I like to spell out very loud and clear is the fact that we are worldwide the majority of the caregivers. So this is not really related to the sex of the individual, rather to the gender of the individual. And being a caregiver, especially when you do caregive full time, it is a specific risk factor to depression, but also to dementia. This is due to social isolation. This is what we learn also thanks to the work that several researchers around the world have done, but then has been also endorsed and reinforced by the recommendation of the WHO in how to prevent Alzheimer's disease. And indeed, social isolation, it is one of the major causes of this condition. We also have other reasons that relates to the immune system. So we go back to the biological aspects of the disease and why we are more predisposed than men. And apparently, it's a matter of what we call and know to be neuroinflammation, which leads to a higher accumulation also of toxic protein. What we know, for example, is that women tend to have a higher predisposition to have high level of tau deposition in the brain. And tau, it is the, let's say, one of the neurotoxic proteins that accumulates in the brain in what we described as plaques. And the plaques are the major histopathological finding in Alzheimer's disease and one of the major causes of the disease itself. Interestingly enough, sorry.
No, let's unpack a little bit. That's a lot. So let's start with the hormones, because every woman on this planet is going to go through menopause at one time, midlife, and I've spoken to scientists who have explained it to me that when women go through menopause, they drop in estrogen at different rates. So some women, it's more gradual. Other women, they kind of fall off a cliff. And it's the women who fall off the cliff where they think it's particularly makes you particularly vulnerable to diseases like Alzheimer's. So can you talk a little bit about that? And also in terms of the hormones, I mean, I guess we're talking more about the early onset folks rather than later onset, because if you get Alzheimer's in your 80s, does that mean that maybe 30 years ago, your brain suffered a drop in estrogen and you're still vulnerable? Or are we only talking about a specific population of the earlier onset folks?
Well, you know, when we talk about Alzheimer's disease and we refer to early onset, it is mainly what we know to be as the disease due to a genetic mutation. So we shouldn't mix the two. I mean, in general, the sporadic form of the disease, which is the classical Alzheimer's disease, it is correlated to this estrogenic drop. And this basically leads to have this higher vulnerability to the disease that some women might experience earlier and others might experience later. But this is not really what necessarily happened with the early onset patients. So we have that, as I said, early Alzheimer's disease, which is usually the familiar form of the disease, it is due to a predisposition in a genetic mutation in a gene. And then we have that the late onset of Alzheimer, might be due to causes like, as we said, the drop in estrogens.
So that's where I get confused, because menopause is like in your mid 40s to 50s, right? And so if you get like my mom got Alzheimer's, she was in early 80s, right? So obviously she had gone. So what do we know? I mean, how much do we know about the interaction of hormones and brain health?
Well, it is still highly discussed and research is not very clear. I mean, we also don't really know if hormonal replacement therapy might be protective or not. So there is a high debate. I can tell you that even the number of pregnancy are speculated to be related to the predisposition to develop Alzheimer's. So the research has to really understand what it is that link. Certainly, we know that some women are more resilient and they have that brain reserve that might delay the onset of the symptoms of the disease. What we know also is that the accumulation of toxic proteins starts very early in the journey of this condition, even 20 years before. And you can imagine that if you maybe have those type of lifestyle that prevent the onset of the disease in a very early form, then you are on a good path and you are a lucky individual. Other people that might not have that type of either a brain reserve or brain resilience or that specific lifestyle that will prevent the early symptoms to appear, then might develop the disease a little bit earlier. It's a multifactorial condition where many players have a role. And as we said, women certainly are at the center of this condition. More research has to be done to understand why. I can tell you a set of data that we want to now carefully analyze. You might have certainly heard of the approval of those disease-modifying treatment. Mm-hmm. Aducanumab was one of the first. I think it's around 2 years ago now. Yep. That it was approved, and then we had on the 6th of January this year the approval of lecanemab. Those are two molecules highly related, antibodies, immunotherapy. When I've seen the first data about aducanumab, and there was one of the studies that was in the laboratory where the molecule was developed here in Zurich around the corner, I was struck by the fact that there was a set of data in the FDA medical review pointing to the fact that this immunotherapy might have acted better in the male population versus the female one. But, you know, when it was about aducanumab, I said, let's watch and wait. It's just a trend. It's not really powered the study to understand those differences. Then, you know, we got data about lecanemab, the same type of result. It seems that the drug works better in the male population versus the female population. And now we had at the recent Congress that was at CTAD in Gothenburg 2 weeks ago, that the data about gantenerumab, third antibody, were disclosed. Now, gantenerumab was not proven to be effective in reducing the symptoms, but it was proven to be effective in reducing the plaque. And once again, what it came out is that it acts better in the male population versus the female one. So they also showed that women had more tau deposition. What I'm trying to tell you is that there are evidences pointing to these major differences. What is the real cause? We still don't know. If it is purely biological, if it is gender combined with biology, if it's really due to estrogens or other cause that relates to the drop of estrogen during menopause and increased, for instance, the neuroinflammation. We know that women also, while going through menopause get more predisposed to diseases like inflammatory disease. Let's think about arthritis, rheumatoid arthritis, etc. So there might be a strong interconnection about these multiple factors, but we need to do a better science to understand the reason why. And in my opinion, we also need to do better study design to characterize early enough all these changes and also the specific changes between men and women, because the data start to point at this. So the call to action from us as scientists, it is, let's analyze those data, let's pull the data together, let's make some meta-analysis, or let's make a postdoc analysis to really understand if this trend that we saw in this big data set has statistical significance or a clinical significance.
You know, it's a lot of people are so surprised when I say this, but the truth is that, and it's an infuriating fact, that women weren't even allowed into studies until the late 70s. And so research has a long way to catch up, and there are very few women-focused studies. I mean, that's just the cold truth. It's getting better than it was, but we still don't, and what you point out is so important, that like a lot of the results of these drugs that are being hailed as a breakthrough, the monoclonal antibodies that you were talking about, both Aduhelm and Leqembi, those two drugs are being hailed as a big breakthrough. But if the truth is that actually men perform, yielded better results than women, then, and 2/3 of the cases out there are women, then how can we actually say, wow, this is a great thing, and
it is still a great thing. I mean, it is still a great thing because it took us 20 years to arrive to this momentum. And I think it is also a great opportunity to better understand why and how to tailor that therapy to the male body or brain versus the female one. Maybe it's a matter of dosage. Maybe it is a matter of how we metabolize those antibodies. What I'm saying, it needs to be better understood. Nobody to blame. It is just to improve medicine. It's to improve the way we do science and understand the fine-tune of this finding, because they could unlock completely unknown mechanism. And then, as I said, adjust the dosage, adjust the administration route, or even make a female, as you said, specific study. We, in fact, advocate in these cases of multifactorial complex diseases for studies that eventually include only women. Why not? I mean,
one thing I'm very confused about is when at one time, it was believed that it's just a matter of women living longer than men, and that's why there's more women with Alzheimer's. But that changed. Why did that change? What did we find out that made us believe now, wait, it's not just the age factor?
Well, it's not just the age factor indeed. And actually, the sad news that I can give you in addition to that is that although women tend to live those couple of years longer, the quality of life, it is much worse, because comorbidities and chronic diseases in women debilitate them profoundly, such as that they live much worse. There is one data that might be very interesting for you. It was presented by the OECD, pointing to the fact that those states that provide the data have certainly confirmed that Alzheimer's disease is more frequent in women. But interestingly enough, women are also the one that get more often institutionalized. So they live into elderly homes or care homes. And interestingly enough, and sadly enough, they also receive a higher prescription of antipsychotic. Now, you might know that antipsychotics are a proxy indicator of poor standard of care. They are not really a specific treatment for Alzheimer. They are certainly not the cure for Alzheimer's disease. And this is saying that women, yes, they might live longer, but it's not an advantage for them. As we said, more comorbidities, more institutionalization, and even higher prescription of antipsychotics. So again, the reason why must be clearly understood. I think that the immune system plays a major role. It's not yet very well characterized how our brain might be inflamed eventually more than the one of a man. we know that other type of diseases that have an inflammatory component, let's think about multiple sclerosis, it's exactly the same, 80% women. If you think about the NMDA receptor encephalitis, that it is a rare form of encephalitis due to antibodies against the brain, again, it's merely with females. So there might be some intrinsic predisposition to the body of a woman, the immune system of the woman, and the interconnection with the brain that might predispose our brain to a higher susceptibility to this type of diseases. It's not only Alzheimer, it's migraine, it is multiple sclerosis, it is depression, anxiety. And again, depression, as we said at the beginning of our conversation, predispose to the risk of developing dementia. And if 80% of the women who have 80% of the patients who have depression are women, you understand they are much higher, more predisposed than a man to develop dementia. So there is this interconnection.
So we have a question from a member of our audience. Diana is asking, what might be the best registry data to look at the natural history of Alzheimer's in women to answer some of these questions, if that exists?
Well, I would say that one of the most informative type of study in this regard, it is the finger study. I don't know if you heard about it or your audience know the study, but Professor Kiviperto, Mia, she's doing a phenomenal type of study in characterizing how the disease evolves, how to implement specific measures to prevent that the disease progress further. One of those is cognitive training. Certainly you have to keep the risk of diabetes or hypertension under control. You have to keep on exercising. You need to be socially engaged. We said that already. You have to correct for ear loss. Ear loss is a specific risk to dementia, and nobody really talks about it. There is a high correlation between cognitive decline and ear loss. So to correct for ear loss, it is fundamental if we want to age healthy and if we want to age engaged with the rest of the society and minimize the risk of getting dementia. So this is certainly one of the best registry to really understand also the subtle differences between specific predisposition to Alzheimer in men and women, and she's doing this type of analysis.
Antonella, tell us what the aim and the goals are of the Women's Brain Project. What are you trying to get more research into gender-based research, or what's happening there?
Deborah, it is a huge endeavor. Women's Brain Project started in 2016. We registered as an association in 2017. We were 3 friends, female scientists with respective kids pulling left and right. They wanted to go home after an ice cream. And we said, you know what? We heard from some prominent philanthropic colleagues in the United States that Alzheimer is more female. Let's go and understand the science and the reason why. And let's put the evidences on the table, because those American colleagues were not coming from the science. We were the scientists. So we got inspired. And our mentor, including my mentor that was the founder of aducanumab, right? The discoverer of, the man who discovered aducanumab, told us, is it really needed? And we said, yes, it is. And we started to bring the scientific evidences on the table, so fact-based. And this basically made an explosion of debates around the world as why this matter. You know, the first publication that went on Nature Neurology Review brought us to the BBC. And when the BBC called you in, then you just throw up a bomb. And each scientist started to get excited. Okay, let's look at the sex and gender differences in Alzheimer, in migraine, in stroke, in any type of disease, even COVID. We were the first organization, Deborah, around the world to communicate to the media, hey, be careful, there are more men dying of COVID rather than women. And we knew that because we had a colleague that was in China trying to help the affected area, and she was sending us information and data. So what we do, we advocate for sex and gender analysis in research and drug development, but also in novel technology design. I am also the chief medical officer of a startup that is using digital technology to study the brain and analyzing it with a test that you can do on an iPad. Now, with this, what we also did was to basically generate the scientific evidences. What we want to achieve, it is, we call it Women's Brain Project. You know why, Deborah? Because a project has a beginning and an end. And I want, this is my legacy to the world, that in 10 years, this debate is over. This project has to be finished. because we solved the project. We solved the problem, and we finally understood what are the implications of sex and gender differences in how we disease for the brain and beyond. We are establishing a sex and gender precision medicine research institute in Switzerland with a global reach out. We are collecting the funds for doing this. And you know, our research never ends. We just got the front page of Lancet Neurology. And I tell you why, because we just did a work with the Economist Impact Unit to understand which are the economical implication of neglecting sex and gender differences when we do neuroscience and research for neuroscience. Because when you give a tag in terms of, you know, economical return,
Yes.
then people start to understand what it's all about.
Yeah, absolutely.
Sadly.
And it's so badly needed. And, you know, I keep coming back to, you know, I know so many people who are on hormone replacement therapy now, because that's becoming more the standard of care, but we actually don't know, right? We don't know a lot about it. So,
we don't know a lot. It's very controversial, Deborah. We still don't know. There are some evidences saying they are helpful, others say they do nothing, and others they even say they make it worse. So it's very debated in the field. What I can say is that certainly the lifestyle implementation that I mentioned earlier are certainly the best tool to prevent Alzheimer to appear. I'm not saying that they cure, but at least you can delay the onset of this condition.
Yeah, kick the can down the road, so we say.
Yeah, exactly.
Thank you so much, Antonella. And we've posted the link to the Women's Brain Project for any of you who want to know more. Also, don't forget to sign up for our newsletters, because that's when we're telling you about talks like these. We wish you all the luck. Let us know, please, when more research comes out on gender-based research. And, you know, we want to know why women's brains are more predisposed. But Antonella, thank you so much for your time.
You're welcome. Thank you.
And your thoughts.
Thank you. Bye-bye.